Very good morning, my dear students. Today we are switching a new topic, anti-cancer drugs or anti-neoplastic agent. Neoplasm or cancer or tumor is defined as the growth or mass of abnormal tissue formed due to the excessive and autonomous and uncoordinated cell proliferation. This phenomenon occurs as a result of loss of control mechanism of cell and abnormality in chromosomes or mutation in the DNA, right? So that collectively we are calling is the cancer, right? This is the definition of cancer or tumor or whatever it is. But the term to neoplasm derived or mean the new growth and the process of cell proliferation is called neoplasmia. This branch of medicine, neoplasia, is the branch of medicine which deals with the extensive study of neoplasm or neoplasm, otherwise called tumor, and its development, diagnosis, and treatment is called oncology. So you heard about the word oncology, right? The oncology the word is derived from the Greek word onkos. Onkos is nothing but it is a tumor studies. Okay. Generally, the term cancer is used for all malignant tumors. Okay. In this one, in the syllabus, as per the KUHA syllabus or as per the PCA syllabus, we have following things you have to cover. The first one is alkylating agent. In that one, we have to study following drugs like meclorethamine, cyclophosphamide, melphalan, chlorambucil, busulfan, thiotropin. Second classification, antimetabolites. It's a mercaptopurine, thioguanine, fluorouracil, cytarabine, methotrexate, azathioprine. Then antibiotics, dactinomycin, dinorubicin, doxorubicin, and bleomycin. Then plant drugs, etoposide, vincristine, and vinblastine. Then miscellaneous, cisplatin and mitotane. So these are all the things we have to cover as per your KUHA syllabus. In this one, we have to study the synthesis of meclorethamine, synthesis of mercaptopurine, methotrexate. Remaining all we have to study the mechanism of action, use, etc., etc., etc. Okay. So in this one, in this regard, we are going to discuss in the next thing what is the learning outcome, why we are studying all those things. So here the things we have to learning outcome we are used this define the cancer and describe cell cycle, able to demonstrate the risk factor, characters and diagnosis and treatment of cancer, able to understand warning sign of cancer, list of anti-cancer drugs and classification and mechanism and synthesis, and able to demonstrate the mechanism of anti-cancer drugs, describe the toxic effect of anti-cancer drugs. So these are all the things we have to discuss, or with it, that reason we have to study in these chapters. So define cancer. Cancer is a rapid creation of abnormal cell and growth beyond their unusual boundaries, and which can then invade adjoint part of the body and spread to the other organs. This process is referred to the metastasis. Metastases are the major cause of death from the cancer, as per the guidelines, as per the WHO. Cancer normally medically is a malignant neoplasm. It is a broad group of disease involved in the unregulated cell growth. Okay, in cancer cell divide and growth uncontrolledly and forming malignant tumors and invading nearby part of the body. The cancer may be spread to the more distant parts of our body through the lymphatic system or the bloodstream. Not all tumors are cancerous. Benign tumors do not invade the neighboring tissues and do not spread throughout the body. There are over 200 different known cancers that affect humans, that according to the studies. So these all are the risk factors. Why the cancers are occurring or how it is affecting. Maybe these all are the main factors. Tobacco, sunlight, ionizing radiation, certain chemicals and other substances, some viruses or bacteria, certain hormones, family history of cancer, alcohol, poor diet, lack of physical activity, or being overweight. So these all are the risk factors. Okay. So now we can see the characteristics of cancer. What are the basic characteristics of cancer? Cancer arises a result of series of genetic and epidemic changes in the main genetic lessons being inactivation of tumor suppression genes, then the activation of oncogenes. So what do you mean by oncogenes? It's a mutation of the normal genes controlling cell division and other processes. It's called oncogenes. Then cancer cell have four characteristics and distinguish them from the normal cell. It's the uncontrolled proliferation, loss of function because lack of capacity to differentiate. Then invasiveness, then inability of metastasis. Okay. Then next one is the cancer cell have uncontrolled proliferation because of change in the growth of factors and their receptors, intracellular signal pathways, and particularly those controlling the cell cycle and the apoptosis. Then telomerase expression and tumor related angiogenesis. Okay. So these all are the basic characteristics of cancer. These are the we can see the 7 warning will produce our body. Okay, these are the 7 warning will produce our body to sign of cancer. First one is according to the American Cancer Society, caution, CAUTAON. Okay, caution is indicating what? Change the bowel or bladder habits. The next one is sore that does not heal, unusual bleeding or discharge, thinking or lump, sorry, not thinking, thickening or lump in the breast, testicles, or elsewhere, indigestion of difficulty swallowing, obvious change in the size or color or shape or thickness of the what, mole or mouth sore, nagging, cough or hoarseness. So these all are the 7 warnings. It is a recognized. These all 7 signs are recognized by American Cancer Society. Okay. The main thing is the change in the bowel or the bladder habit, a sore that does not heal, or unusual bleeding or discharge, thickening or lump in the breast or testicles, and indigestion or difficulty in swallowing. Obviously, changes in the size, color, shape, thickening of what, mole or mouth sore, and nagging, cough or hoarseness. These are the important signs, 7 signs of cancer. Now we can see many number of cancers we can see, right? Like carcinoma, sarcoma, leukemia, lymphoma, and myelomas. So what are they? Based on the function, okay, or location, we can differentiate. So carcinoma is nothing but is a tumor derived from the epithelial cell. Those cells that lie in the surface of our skin or organ. 80 to 90% of cancer cases reported through the carcinoma. Then sarcoma, the tumor derived from the muscles or bone or cartilage or fat or connective tissues. The next one is leukemia, the cancer derived from the white blood cells and the precursor compounds. And lymphoma, this is a cancer of bone marrow derived cell that affect that lymphatic system. Then myeloma. Myeloma is nothing but the cancer involving the blood cells responsible for the production of antibodies, especially B lymphocytes. So these all are the various type of carcinoma. And also there is a two different type of cancers are there. First one is the benign tumors and second one is the malignant tumors. So these all are comes under these carcinoma, sarcoma, leukemia, lymphoma, and myeloma. These all are comes under malignant tumors. Then some other cancers also there. That is the benign tumors. So benign tumors, that means that is a slow growing and non-invasive tumors. Okay, that is not spread, because we have to see the two different kind of time. There is the benign tumors and malignant tumors. The benign tumors are slow growing and non-invasive tumors that is not spread. Okay, so example for that one we can see is a fibroma, chondroma, osteoma, like that. Okay, these all are the benign tumors. Okay, so here these all are the basics of cancer things. So here we are going to discuss about antineoplastic agents or antineoplastic drugs that used for the treatment of cancer, malignancy, tumor, carcinoma or leukemia or neoplasm, whatever it may be. The neoplasm, it is a Greek word obtained from the neoplasm is obtained from the Greek word. Neo means new, plasm is formation, new formation. So neoplasm refer to the group of disease caused by several agents, namely chemical compound, radiant energy. Okay, cancer is characterized by abnormal or uncontrolled or division of cells which produce tumors that invades adjacent normal tissue. Often, cancer cells separate themselves from the primary tumors and they carried out by the lymphatic system to reach distant sites of organs where they divide, they form secondary tumors, that is a metastasis. Okay, so this one we can see the different type of cancers. So you have to remember there is a two different type of cancer. There is a benign tumors and malignant tumors. Benign tumors are simple one, that is a slow growing and it is not spread. But malignant tumors are not like that. These are the carcinoma, sarcoma, leukemia, lymphoma, myeloma. These all are the malignant tumors that will be spread, that is a harmful to our body. Now we can give what is carcinogenesis. What is happening, how it is happening in our body, because one normal cell it get damaged or DNA is getting damaged. That's why, because how it is getting damaged, maybe it is getting damaged due to the environmental DNA damages like chemical, radiation, virus or bacteria, whatever it may be. So what will happen, the cell normal is a DNA will be damaged. So what will happen, the mutation in the genomes of somatic cells. So what will happen after this one? It may be these cells may be activation of growth promoter of oncogenes or altering the genes that regulate the apoptosis and inactivation of cancer or suppressive genes. They may be happen. Then what will happen? The next step is expression of altered gene product, loss of regularity gene products. That may be is a clonal expansion, additional mutation or heterogeneity. So what will happen? This normal cell it is turned to the malignant neoplasm. Malignant neoplasm. Remember the word malignant neoplasm and benign tumors. These two are two different cancers. Okay. So benign tumors are it is a slow growing or in non-invasive tumors, but malignant tumors are not like that. Okay. So now we can see how the mutation is happening, how the malignant cell by mutation of this malignant cell. The normal cell, the normal cell, then first mutation, second mutation, third mutation and fourth mutation. So what is happening? Even each and every mutation of normal cell, what is happening? A normal cell is a mutating cell seems normal, but it is a predisposed to proliferative extensively. Okay. The second mutation, cell benign to proliferate too much, but it is otherwise normal. The third mutation, cell proliferate rapidly. It also undergoes structural changes. Okay. Then the fourth mutation, cell grows uncontrollably and looks obviously damaged. Or obviously degenerated. Okay. So that is a malignant formation. This is the way it is happening. Mutation is happening in our body. Okay. Now, what is the thing? What is the uh, treatment of cancer? So normally we know the chemotherapy is the first one, because see first before 1955 only surgeries are available for the cancer, but in 65 after 55 radiotherapy, after 65 chemotherapy. Now we have many other things like immunotherapy, gene therapy. Still these all the things are going on because these all combined therapy. Now they are giving the combined therapy. So this is a thing significance to various palliative chemotherapy, curative chemotherapy. This all these things are happening for the treatment of cancer. Okay. Now we can go for how will you diagnose the cancer? How will you diagnose the cancer, right? So first one is the biopsy. So biopsy is nothing but the involved in the histological examination by pathologist of piece of tissue. Okay, they will take the tissue of the damaged area or damaged tissue. Then another imaging technique like CT scan, MRI, UTZ, and then we can see other chemical laboratory test. Then like other tumor markers, especially nowadays we have many tumor markers are available. Breast cancer we have tumor markers, gastrointestinal tumor markers, ovarian cancer we have cancer this one tumor marker, and prostate cancer we have because everything we at present we have, we can we can identify. Then cell cycle. Okay, the cell cycle specific and non-specific drugs which is happening. So mainly the left cell cycle, what is the thing? Synthesis of cellular and component and required for the mitosis, mitosis phase, because these all are the phase of cancer, right? G1 and G2 and S phase and the M phase. These are all the things we know, right? There's the resting phase, mitotic phase. These are the important phases of thing. Like the mitotic phase means cell division, and the resting means the G0 to G1 and G2, and S1 is the DNA is replicated, and the G1 is also synthesis of enzyme needed for the synthesis. This is the normal cell cycle of cancer drugs. Then it is a next one is cell cycle specific drugs. Some of the drugs will be like antimetabolites and biomycin, peptide antibiotic, Wingea alkaloids, etoposide. These are all the drugs effective for the high growth fraction malignancies such as hematological cancers. Then next one is the cell cycle non-specific drugs like alkylating agent, antibiotics, platin, nitrosourea. These all are the effective for the both low growth fraction malignancies such as solid tumors as well as the high growth fraction of malignancies. Okay, so what is the limitation of this type of therapies? You know, because if you are treating in the cancer, it is not sure to be cure, right? So like limitation of therapy is that cancer cells are very rapidly develop resistant to the antineoplastic drugs. Then difference between the normal neoplasmics and human cells are merely quantitative, and biochemical and morphological difference between normal and neoplastic cells are slight. Therefore, antineoplastic agents are devoid of selective toxicity to the tumor cells. Then anti-neoplastic cell or agents will kill the cell by first order kinetics. That is, they kill a constant fraction of cells. However, some of the cancer cell elude killing, and one of these cells may be restabilize the tumor. It is extremely difficult to kill all the malignant cells. The most anti-inflammatory drugs are highly toxic to the patients. So these are all the limitations of anti-cancer drugs. That's why we have very less number of anti-cancer drugs are available. Okay, even though if you are treating with the chemotherapy, around 90-95 percentage people will die also, right? So what are the adverse effect? So main adverse effect is uh, main thing is bone marrow toxicity, hair follicle toxicity, hepatotoxicity, skin rashes, and pulmonary toxicity, cardiac toxicity, other toxicities like many other CNS toxicities like nephrotoxicity, immunosuppression, fever, anaphylaxis, catarrhs, hemolytic anemia, pancreatitis, and pituitary insufficiency, adrenal insufficiency, coagulation problems, suppression of growth, and cardiotoxicity, carcinogenicity. These all are the common side effect for all the cancer anti-neoplastic drugs. So now we can go for the anti-cancer classification. Okay, as per your syllabus or as per the course, this one, we have to see the anti-cancer classification. So classifications are many number of classifications we are having. First one is the antimetabolites. So in that one, we have to study capecitabine and fluoxetine and fluorouracil, mercaptopurine, methotrexate. Okay, then 6-thiogluconin. These all are the comes on anti metabolites. Then we can see antibiotics. This is a bleomycin and doxorubicin, doctinomycetin. So these are all the important antibiotics we have to discuss. Then alkylating agent, busulfan, curmestin, chlorambucil, cyclophosphamide, lumestin, melphalan. Okay, so these are the drugs comes under alkylating agent. Then microtubule inhibitors like vincristine, vinblastin, and vinorelbine and palixital. These all are the drugs comes under microtubule inhibitors. Then steroidal hormone and their antagonist, like we can see it is amino glutathamide and letrozole and the estrogen derivatives, tamoxifen, etc., etc. Then various monoclonal antibodies, then other miscellaneous drugs like various type of this one asparginase, cisplatin, interferons. Okay, so that and all we are discussed one by one. Okay, now we can go for the basic classification with type like alkylating agent. Alkylating agent comes from nitrogen mustard, example for meclorethamine and cyclophosphamide, eposimide, melphalan and chlorambucil. Okay, then another one is the ethylamine and methylamine derivatives like ultramide, then alkyd sulfones like busulfan and nitrosourea, that is the quercetin, and triazines, streptozocin, then platinum coordination compound like cisplatin and carboplastin. Then other drugs like antimetabolites, folic acid analogs like methotrexate, pyrimidine derivatives like fluorouracil, that means 5-fluorouracil, cytarabine, pemixtrat. Then purine analogs like mercaptopurine, okay, pentostatin. Then interferons like interferon alpha, leukotriene, antibiotics. Okay, then hormones. Hormones which means like adrenal suppressants like aminoglutathamide, adrenocorticosteroid prednisolone, progesterone, hydroxyprogesterone, methoxyprogesterone, estrogen like diethylstilbestrol, ethinyl estradiol, then anti-estrogen like tamoxifen and terimorphin, androgens like testosterone and fluoxymetroxone, and anti-androgen like flutamide. Then natural and semi-synthetic drugs like antitubule agent like antimicrobial agent vinca alkaloids, vincristine, vinblastin, and virinobilone, and taxane like um, plaxital and etoposide. So these all are the drugs comes under the classification. So today we have discussed the what is the neoplastic agent, its classification, what is its chemistry. Okay, now the next class we can discuss the medicinal chemistry of these drugs which is classified under antineoplastic agent. Thank you everyone.